Hi, my name is Melissa Adams Van Houten, and I am a gastroparesis patient and advocate. I wanted to come on today because I've been trying to process the impact that the COVID-19 pandemic is having, not just on the gastroparesis community, but on some of our chronic illness communities in general. These are difficult days, and I think the impact is really twofold. First of all, there has been a negative impact, and I don't think that we should deny that. I'm not one to dodge issues or pretend like everything is hunky-dory when it's not, and I don't think that we do our communities a service to not recognize the negative impact this is having on us. To begin with, there is a lot of fear out there, or at least concern. In our community, we are sort of already in a weakened state. A lot of us are malnourished, dehydrated, and just worn down physically. So there is fear or concern about our susceptibility to this pandemic to begin with. Some of my people have underlying conditions that make them high risk, like diabetes. Some of them are autoimmune, live with autoimmune disorders, or are immunocompromised. So they're very concerned, first of all, that they're maybe at higher risk for contracting this virus. But even greater than that, if we do contract this illness, what does that mean for us, since we're already in sort of a compromised state and it's difficult to fight off anything additional? We already have physical symptoms. If we get this virus, how much more will it affect us than it would a normal, healthy person? How will we be able to fight that off, and will we be able to bounce back? So there's a lot of concern and fear over that. There's just the unknown. Will they be able to treat us, and will we be able to survive this, basically? And I know that unknown is out there for everyone, but in our community, it's a little bit more concerning because of our already pretty severe physical symptoms and our rundown states. I think in addition to that, there is concern about the increased isolation that we're seeing. We are already a community, as are many of these chronic illness communities, where there's pretty serious isolation on a daily basis. Many of us are completely homebound or homebound to a large extent, and this pandemic is making things even more difficult for us than they normally would be. We rarely get out, but now we can't even get out for those few events that we used to. And this is long term for us. You know, the pandemic will end, but this is how we live on a daily basis. And so the increased isolation, even over a short period of time, is very difficult for us to deal with. We can't get out. We rely on our friends and our family to come to us many times, and that isn't able to happen right now. And of course, we're turning to social media and those kinds of sites, but it is very difficult for us to deal with that increased isolation. In addition to that, I'm hearing a lot of concerns out there about not having access to regular medical care or medical supplies that are necessary for daily living. First of all, there does seem to be a shortage of some medications and some supplies, especially the sanitizing type supplies. A lot of my community members live with feeding tubes. They're on TPN, and they need alcohol wipes and gloves and those sort of sterile materials to help them with their normal routine care, physical care. And in some cases, they're experiencing shortages and long waits for those sorts of supplies. And that's very concerning because they're worried that they're going to get an infection or in some way be negatively impacted by this. In addition to that, we're seeing a lot of medical appointments canceled. And you may say, well, that's just short term. And of course, you're seeing those medical appointments canceled because COVID-19 is overwhelming our system. Yes, that's absolutely true. But put yourself in our shoes. We are struggling. Some of us are newly diagnosed, and we cannot eat and drink in some cases. And we've been waiting already months to see a specialist that can possibly help us with our condition. And then we find out, oh, that appointment has been postponed indefinitely. You know, people were holding on for that. They were holding out for that hope and that treatment, and it's being denied them now. And that's a very difficult thing to process. And just normal routine appointments are being postponed, indefinitely down the road. And that's a serious thing for some of our people. They're waiting for, gastric stimulator surgeries or tube replacements or anything along those lines, and they're worried, how long can I hold out without having that appointment? If they do keep the appointment, then they're worried that they will contract the virus while they're out. And it's the same thing with emergency room service. They're sometimes so in such a state, such a physical state, that they feel they need emergency care, but they're very hesitant to go because they might pick up this virus while they're there, and that will put them in an even more compromised situation. So these are very, very serious and concerning issues for our community. And I think that the longer this goes on, the more difficult it's going to be for my people. So I definitely don't want to downplay the serious nature of this pandemic and its impact on our community. But the second part of this, the second sort of impact that I see, or that I hope I'm going to see in the long term, is maybe a positive aspect to this. And that is in the sense that, for all this time, those of us with chronic illnesses have lived with some of the issues that you all, because of the pandemic, are just now beginning to experience. We live with worries about having access to proper care, with worries about the healthcare system being overwhelmed, with the daily isolation. And it's kind of it's kind of amusing to me, and I don't mean to downplay the impact of this on regular, normal, healthy people out there, but it is kind of amusing to me that now that everyone has been under these stay-at-home orders for several weeks, I hear the outcry, oh my goodness, our healthcare system is horrible. It needs to be adjusted. It's overwhelmed. We don't have access. We don't have decent care. We don't have supplies. We are just suffering through this isolation at home, mentally, emotionally. This plays with us. We have got to get more mental health resources out there to people. I don't disagree with any of that. I don't disagree with any of that. And I'm sorry that those of you who are otherwise healthy are experiencing that right now. But this is what my community and many other chronic illness communities have been experiencing all along. And we cry out for help, and we're ignored. And it's not that we want any of you to have to experience this, but we're hopeful that because you got a little taste of what this is like, the fear that nobody will be able to help you, the fear of the unknown outcome, the lack of access to care, quality care, the isolation, that is what we experience on a daily basis and have been all along. And we hope that you remember that when you go back to your normal lives. We hope that this has had an impact on you and that changes will be made for the better, so that we can have that access to mental health resources and decent, proper medical care. I think another thing, positive thing, that might come out of this is a recognition of our economic, financial situation. Many of you out there, because the restaurants have had to sort of rearrange the way they approach business and non-essential businesses have closed down, unfortunately, you are experiencing layoffs and financial crisis short term. For many in my community, that's the normal way of life. So many in my community are unable to work, and in a lot of these chronic illness communities, they are disabled. And yes, sometimes they can get disability, and that helps a little bit, but disability can take a long time to get. And really, let's face it, even if my people do get that money, it isn't exactly a living wage. So you all will go back to your jobs eventually, and you will get that paycheck. But the members of my community and many others out there are still stuck in financial straits. And we hope that you understand a little bit more about the impact of that on our lives. We don't wish it for you. We are glad that you will go back, but we hope that you remember us when you do. Another thing that I hope comes out of this positive thing is the greater emphasis on telehealth, because some of us in remote areas and without access to regular doctors and specialists really need that. And I know that there's been some talk in the medical community about how that's sort of avoided sometimes or underutilized because the reimbursement for that is not good, not up to par. So I hope that that's another thing that changes, that there will be more of an emphasis on that, better reimbursement rates for that, and that some of us will have better access to telehealth now that you see how useful that can be. Another thing is the FDA. It's amazing to me how quickly the FDA can act when it needs to and when they think the problem is serious. And I understand all the risks with that. I do. But now they're being bombarded with, hey, we've got to have something to try. We don't care about the studies. You know, we're dying. We need access to a medication, even if it's experimental. And I still think it's a snail's pace. But for the FDA, this is amazing how quickly they're acting. And so I hope that something else that comes out of this is that we can turn to the FDA and say, hey, remember what it was like in that pandemic when you had no treatments and you were willing to try something that was, not really all that tested and sure? That's where we're at every day. Please help us. And that there will be a better response to that. One more thing that I think that could possibly be a benefit of this, a positive outcome of this, is just the recognition that illness can affect anyone. You go about your lives and you don't think about being sick and you don't think about the ill people who surround you. But just like this pandemic, a chronic illness can hit you immediately and permanently alter your life in the blink of an eye. Nothing you counted on, nothing you prepared for, not mentally, not physically, not financially. It can happen to anyone. And I hope that that's one of the recognitions that comes out of this. I also hope that you recognize that it is not hopeless. We can unite and we can start to solve some of these problems if we're all committed to that. So I guess what I'm asking you is that when you do return to your normal lives, and you will, this will be relatively short term for most of you in the big picture. When you return to those normal lives, don't forget about us in the chronic illness communities who are still living in these conditions. Because when you go back to your normal lives, we will still be living with gastroparesis and other chronic illnesses. Please don't let this lesson go unlearned. We need your help, and we hope that you will remember us. Thank you so much for listening.